Amid the spread of MPOX globally, the Nigerian Center for Disease Control (NCDC) has reported a decline in the number of suspected and confirmed cases in the country over the past 4 weeks. However, health experts in the country have called on the government to implement thorough measures in addition to public awareness, tackling the origins of the disease, and improving health surveillance to prevent further spread in the country. TV360's Ogechukwu Ukekwe completes this next report.
Recent data by the Nigerian Center for Disease Control indicates the surge in MPOX cases is higher in urban centers like Lagos, Abuja and Port Harcourt. The outbreak is coming at a time when health authorities are battling to contain other diseases outbreak in the country, including cholera, meningitis and yellow fever, which according to the NCDC underscores the urgent need for a coordinated approach.
The Nigerian government is making efforts to make vaccines available to the public, especially for the hotspot areas. These vaccines have been shown to have a favorable safety profile. They are not yet in the country, but they are on their way. For health workers, for both private and public, they are further advised to warn when caring for patients, always follow standard safety measures, including preventions against droplets, regardless of their diagnosis. These steps are crucial for protecting both patients and healthcare workers. Wash your hands with soap and water after contact with patients and or their environment. Maintain a high index of completion for MPOX, especially for patients presenting with fever or this typical rash, vesicular or pustular rash in all parts of the country at this time. During triage, the health workers are to use precautionary measures such as placing a surgical mask over their nose and mouth of the suspected patients and covering any exposed skin lesions with a sheet or gown. Isolate all patients suspected of having MPOX as soon as possible.
Although no MPOX-related deaths have been recorded in Nigeria so far, public health experts say there is no cause for panic, urging people to be cautious.
Expect this to happen. It's not out of the ordinary because we are in an endemic area. Now, what is maybe new about monkeypox is that some strains have been detected in non-endemic areas. There's countries where this does not occur. If you take Europe, some incidents have been recorded there, in the United States and some other countries. So when the virus starts occurring in non-endemic areas, then that's when you raise an alarm to let people know that this is the observation now.
Health experts in Nigeria are also advocating enhanced disease surveillance and improved laboratory testing to check the spread of the virus.
The health literacy must be deepened. Now we need to take it to the local government, the CDAs, and the communities that are actually prone to monkeypox. As it is now, every community is prone to it because as long as you allow contact between animals, it's not just monkey, rodents, squirrels, rats, they can actually be a host to this virus. So we avoid them. Those people that are doing hunting, that are doing games, skinning of the animals and cutting, to allow the blood of the animal to touch their body, they need to be a bit careful so that they don't pick monkeypox. Now, we have to strengthen hygiene again, hand washing. Hygiene, you cannot have, over hygiene in a way. Hygiene is very, very key for all of us, as much as government is talking about it.
So far, the NCDC, in collaboration with international organizations, has implemented several measures to curb the spread of MPOX, including vaccination plans for higher risk population. Ogechukwu Ukekwe, TV360, Lagos.